Well, hello everyone, and welcome to our Vida Live for the month of September. Today we are focusing on our Impact Ministries Medical Clinic. For those of you who don't know me, my name is Kristen, and I work with IMC, Impact Ministries Canada, as the operation manager. So today we just want to say welcome wherever you're joining us from. It's so good to have you guys here with us. So we are joined today with a couple of our guests. We're joined today with Dr. Rivas, who you'll see there on the screen, and Ruth is also there as well. So they're joining us in Guatemala, live from Guatemala. And we're also joined today by Dr. Chris, who works with us as our medical engagement coordinator. So we're really excited, and this next about 20 minutes will be just a chance for us to ask them some questions, for them to share a little bit about our Impact Ministries Medical Clinic and what's going on there. So we're going to start, and even before I get into the questions, Ruth, do you want to just explain where you guys are joining us from? Oh, you're still on mute there.
This is Don, and I'm in Tawasin, BC.
Awesome, Don. So Ruth, we'll see if you guys can get that going. And Chris, maybe I'll just hand it over to you while they work on the sound there. And maybe, can you just share with us a little bit about what your role is?
Yeah, so as you said, I'm considered the medical engagement coordinator, and I've been doing that for a couple years now. I've been with Impact Ministries doing short-term mission trips there since 2013, and just did my 15th trip down there this summer. And basically, I just assist the medical clinic in about any way I can. So we made a lot of changes in the last recent years, and we have a lot of teams down there. And I actually just try and assist the medical clinic. Dr. Rivas is our medical director there. And as you can see, he's doing a short-term mission trip right now. I think we have a short-term team there that's out there for about 10 days right now. They've been seeing about 100 patients a day. And so Dr. Rivas runs the clinic there locally. And then I try and do stuff from the United States and North America, and just try and help get the clinic running and help them with their needs, and help teams that are going to go down there, and just support them the best I can. So that's my role.
Awesome. Ruth, I see that the mic's on now, so why don't you try that?
Can you hear me now?
Yep.
Okay, good.
Perfect.
Yeah, we're here in Chijulhá. I said nice to see you guys before, but you didn't hear me. Nice to see you guys all. We're here in the school in Chijulhá, and yeah, we've been seeing 100 patients a day, like Dr. Chris said, and it's busy, it's noisy. I hope you can't hear how noisy it is. And it's it's going great. There's so many people getting to see the doctor, and leaving with medicine. Some people probably haven't seen a doctor in years, and it's really great.
Awesome. So Dr. Rivas, can you tell us a bit about how you first got involved with the Impact Ministries Medical Clinic?
Cuando uno trabaja con grupos médicos como voluntario, siempre está relacionado con otras organizaciones.
So when you are involved in medical missions, you're always going to be involved with different ministries.
Y cuando una de estas organizaciones necesita un médico,
when one of these ministries needs a medical professional,
siempre habrá alguien que dice, yo conozco a alguien que puede colaborar.
There's always someone that says, oh, I know somebody who can help.
Y hace 7 años alguien me conectó con el hermano Les Peters.
7 years ago, somebody connected me with Les Peters.
Porque necesitaban un médico en Ministerios Impacto.
Because they needed a medical professional with Impact Ministries.
Que coordinara los grupos viniendo de Estados Unidos y Canadá.
That could help with the coordinating with the groups that were coming from Canada and the United States.
Entonces, en la plática acordamos algunas cosas con el hermano Les.
And so we were remembering some stuff with Les.
Y una de ellas fue tener una licencia sanitaria para la clínica en Tactic.
And so one of the things that he was needing was a license to run the clinic here in Tactic, the permanent clinic.
Y lo otro fue acompañar a los grupos cuando ellos estuvieran trabajando aquí en
And-
Guatemala.
So, and also to somebody that could be with the teams while they're here in Guatemala.
Por eso es que estoy acá desde hace 7 años colaborando con Ministerios Impacto.
And so that's why I've been here with Impact Ministries for the last 7 years.
And Dr. Rivas, how have you seen the medical care of patients improve since you have started kind of doing a monthly regular visits to the clinic?
Bueno, el trabajo en la clínica nos ha ayudado mucho.
The work in the clinic has helped us a lot.
Tener 2 enfermeros de planta o cada día siempre es
It's
importante.
very important that we have 2 nurses that are there every day.
Porque pacientes que vemos con las brigadas médicas pueden tener un seguimiento después de esto. en la
That way,
clínica.
the patients that we see can have follow-up in the clinic.
Esta semana con el grupo trabajando aquí en Chijulhá,
Though this week, having this group working in Chijulhá,
hemos encontrado pacientes que necesitan tener un seguimiento o
we've found a
consultas.
lot of patients that need follow-up with the doctor.
Entonces siempre procuramos darles las fechas cuando el doctor va a estar en la clínica para que ellos puedan llegar para ser vistos nuevamente.
So we always give them the dates of when the doctor will be in the clinic, or he himself will be in the clinic again, so that they can come next month.
Y aunque yo no esté en la clínica, ellos pueden llegar y pueden ser atendidos o monitorizados por los enfermeros.
And so even if I'm not in the clinic, they can come into the clinic and get monitored and by the nurses that are there.
Pueden llevar algunos exámenes de laboratorio que se les han pedido.
They can bring in labs that we've asked them for, the
Y yo
results,
puedo revisarlos a través del WhatsApp
And
y
I can
dar
see
alguna
them,
indicación.
through WhatsApp, and then, tell them what needs to happen next.
Awesome. So just so everyone is aware too, Dr. Rivas comes for 1 month or 1 week every month and works in our clinic. So our main clinic is in one of our schools, not where they currently are. It's at our Chia Corral school. But when medical teams come, sometimes they do these remote clinics. And so that's what you'll see behind them. There's a team there from the United States this week. So that's where they are. So Chris, I want to come to you for a second. A year ago, I think it was a year ago in September, we did a Medical VidaLive where you were on here and shared a little bit about what was going on with your role with the medical clinic. So that was a year ago. So what changes have you seen in this past year in regards to the medical clinic?
Okay, well, thanks. But I think Ruth and Dr. Rivas are a great example of exactly the changes that are going on or that have happened. And first off, we've been able to invite teams back to Guatemala. So because of COVID, the last 2 years, we had very few teams. The nurses that were there were doing their best to take care of patients. But of course, there's always been great needs there, but the needs were, have been larger. And so in the last year, we've welcomed back teams. As they said, there's a large team there right now that's, I think, from Michigan, is doing a lot of work. And so welcoming them back in the last year has been great. And we have another team that's coming in next month also. I was actually at the team last month. So having teams back has been great to provide more care. Having Dr. Rivas there, and we discussed this our last time, I always felt the need in my heart that just teams would come and go and give the best care they could, but that they really need a physician, or we really need a physician available all the time to see patients with chronic needs, patients that needed follow-up, patients that needed referral to specialists. And having Dr. Rivas there was allowed exactly for those things to happen. He sees patients that need more than just to see the occasional doctor that's able to show up on a short-term mission team. So when short-term mission caregivers see patients, they're able to refer them to see Dr. Rivas in a couple weeks when he's there and let him follow up on them and decide how their care is going. So it's so important for following up on children and adults with chronic needs that need more care than we can just give them in a setting there being seen one time. So having Dr. Rivas there has really allowed that. And the 2 nurses that we have there working full time are giving care around the clock. They're available whether Dr. Rivas or a team is there or not. They're available to take care of patients. And you may have heard Dr. Rivas allude to he contacts the nurses all the time on WhatsApp with helping patients. And if patients have needs he's available all the time to consult on patients, which is quite incredible. So he's there 24/7 when we have needs. And so that's just been such a blessing. And again, the nurses are really active doing stuff with education, going into the schools and teaching the kids and helping them with preventative medicines, things like hand washing and brushing your teeth and eating, nutritional things. And so the nurses being there full time and back have just been a great blessing for the ministry. And then, lastly, I think we mentioned this last time, is we were trying to get a dental program up and running. And I would say this, that we have a lot of dental needs. I mean, the dental needs are just immense. But we started a dental fluoride program this last, I think it started in the spring. So we've been doing it for maybe 6 months or so, where all the children in the schools are getting fluoride treatments applied by the nurses. And we're doing a class at a time when we go in there, and that should decrease cavities or dental caries by 30 to 50% in these children. And so if they already have cavities, it keeps them from getting worse. And if they don't have them yet, it'll keep them from getting them. And so that's been a big thing that we've only been able to do in the last 6 months. And so those are the changes we've seen the last year and the things that we had planned on changing. And just we've had a great impact from those things.
Awesome. And as you said, so medical teams, we have seen a couple this year, which again, we haven't seen probably since 2019. So it's been great to have that back. And just in following up with that, question for you, Dr. Rivas, is just how do visiting medical teams improve the medical care to the students?
Equipo médico que venga de los Estados Unidos o Canadá.
Los equipos médicos de Estados Unidos y Canadá apoyan bastante el trabajo que se está haciendo en la clínica.
The groups that come from Canada and the United States help a lot with what's already happening in the clinic.
En primer lugar, hay más cobertura, o sea,
There's
podemos ver muchos más niños.
a lot more coverage because we can see a lot more kids at once.
La semana que ellos están trabajando acá en Tactic o en las comunidades,
The week that they're working in wherever in Tactic or in one of the communities,
pueden llegar cierta o gran cantidad de niños que solamente para mí como médico sería muy difícil poder atender.
we can get a lot of kids through that. It would be really hard for me by myself to see them all at that number.
Aparte de eso, también tenemos más acceso a medicamentos
We also have more access to medicine,
que los grupos están trayendo.
the medicine that the teams bring.
Y también podemos aprovechar que los grupos
We can also use, like, a lot of times specialists come.
por ejemplo, en el grupo que estamos trabajando ahora tenemos un pediatra y algunos de medicina interna.
So right now we have a pediatric here and some internal medicine doctors as well.
Y el apoyo del doctor Rick Schweitzer es bien importante porque tiene mucha experiencia en misiones médicas.
And the Dr. Schweitzer that's here, he is also very important because he's had a lot of medical teams.
De igual manera, cuando vienen
And so-
los grupos del doctor Chris Brandenburg,
Also, like when Dr. Chris comes as well.
en cierta forma podemos decir que la importancia de trabajar en grupo es grande.
We can just say that it's very important, the work that groups do.
So Chris, what kind of changes or things that you would like to see with the medical and dental clinic in the near future? What's some of those kind of hopes?
Yeah, I definitely want to see more medical teams. As you said, we got online with new medical teams, visiting teams coming this year. I'm really hoping in 2023 with travel restrictions easing up and those sorts of things that we have a lot more teams next year. So we certainly have some people lining up and a schedule that's filling up. And so I'd like to see more medical teams. It's been great this past year. We talked about the changes we've made, and we're kind of evaluating those. And I feel like medical, I think Dr. Rivas and I feel like the medical teams are giving great care, and that things have really improved the last year, and we're able to meet a lot more needs. Our dental needs, I alluded to that earlier. We really need better dental care with the children, and we are doing what we can, I think, with the education and teeth brushing and the fluoride programs, but we haven't been able to get dental teams down there. And so I would say I'd sure like to improve our dental care more. We're looking at options of local Christian dentists, if there's people that can help and fill in, I would implore you, if you know of a dental team or dentists that want to come, just in seeing the children there, I feel like their medical needs have improved a lot, and we're doing a great job there. But there's more that we can do from a dental standpoint, and so I think our needs there are just are immense. And then we're also just evaluating our equipment that we need to upgrade. I mean, we always have to have a pharmacy staff. We have to have dental equipment available and all that. We're looking at upgrading some of our equipment in the clinic right now, and so those are things that we're looking at doing over the next year or so. Those are the things that we're looking for: more teams, a little better equipment, better dental care are the things that we'd really like to improve upon.
Awesome. And so this question's for Dr. Rivas. What are some of the more pressing medical or dental needs of the students that are still unmet, or of the students that you're seeing?
Por ejemplo, en los niños, cuando los evalúo, siempre les examino sus dientes.
When I see a student, I always look at their teeth.
Y estamos tomando la caries dental como un problema de salud.
And we're taking the cavities that they have as a problem with their health.
Se está dando educación a ellos acerca del cuidado de los dientes.
We're trying to educate them how to take care of their teeth.
Pero algunos ya tienen sus dientes muy lastimados.
But some of them have their teeth really bad already.
Entonces es importante, como decía el doctor Chris,
As
tener
Dr. Chris said, it's
grupos con dentistas
very important to have groups with dentists
o tener también un médico local que
or
esté
somebody local
atendiendo.
who could help.
Hemos avanzado bastante
We've gone ahead a lot,
aplicando el flúor 2 veces por año. a los
putting the
niños.
fluoride on the kids' teeth. The plan is twice a year.
Pero creo que nuevamente esa es una necesidad muy importante que tenemos que solucionar.
But I think it's a problem that we do need to find a solution.
Y por otro lado también tener lugares a donde referir a los niños
Also to have places where we can refer children to
con necesidades especiales.
that have special needs.
Me refiero a enfermedades de algún tipo
I'm talking about
específico.
specific sicknesses.
And Chris, for non-medical people who may be watching, how can they help with the medical and dental needs of Impact
Okay,
Ministries?
so with non-medical, actually I would say even with our medical teams that come down there, I always use non-medical people on my medical teams. I'd say people are interested in coming and want to serve on a medical team. My pastor and his wife actually are non-medical, and every time they come down, they actually help our medical team because they just love taking care or seeing patients in the clinic. And so they help out in the pharmacy. They help with registering patients. They help with data entry. Like we have scribes that do a lot of our notes in our computer. And so if you want to be on a medical team, you don't have to be medical to actually do that. And so there are ways for them to actually help in Tactique. And then, I would honestly, the other ways that they can help is obviously, prayerfully from a prayer standpoint of, just, we have a lot going on in the clinic right now. And so, I asked for prayer for Dr. Rivas and the nurses and the staff there. And as I said, we kind of have some hopes and dreams of some things that we want to do at the clinic and attracting dental teams, more dentists and dental teams. So from a prayer standpoint, I ask that we were in your prayers every day to do things that we can to improve the medical dental clinic. And then obviously from a giving standpoint, financially, the things that we've brought into the clinic, there's certainly a cost for those. And we've actually had a couple of great donations that actually someone donated the fluoride treatments, all the kids, and toothbrushes for all the kids, and toothpaste for the kids. That we had someone that donated that. We have some donors that are actually giving monthly. And I think if you go to our webpage, the Impact Ministries Canada or Impact Ministries US website, there's ways that you can give. And it gives a cost of what it is to have a nurse for a day, a doctor for a day, a pharmacy for a day, what it costs to have a dentist there. Those sorts of things are on there. And so again, obviously from a donation standpoint, I want to first off thank the people that have given, have allowed us to do all the changes we talked about in the last year, having Dr. Rivas there, having the nurses there full time, having a completely stocked pharmacy, doing the dental fluoride programs. All that's only because people have given, financially. So if it touches your heart to give a one-time payment, that's really gotten us to where we're at right now, or monthly. So I just thank you for what you've done so far, and we can always I have big plans that we can always do, and a lot of it is cost prohibitive. But so thank you for that. And again, just keeping Dr. Rivas and the nurses and the whole teams that are coming in your prayers are wonderful. And if you want to come down and be on a medical team, we can certainly find a spot for you, whether you're medical or not. And so I just thank you for all of that. Lastly, I'd say our fall newsletter is getting ready to come out and should hit people's mailboxes next week. And we actually have, there's an interview with Dr. Rivas on there. There's some short information about people have come down on teams before and what they do. And again, we've used physician assistants and nurse practitioners. They are very helpful. People who do data entry, work in the pharmacy, non-medical people, interpreters are helpful. So there's some information on that newsletter that'll be coming out here in the next week or so, also of how people help us in the clinic.
Awesome. So we do get some questions coming in already. So just a reminder, if you have any questions, to feel free to write them in the chat. I am going to ask one more question to Dr. Rivas, and then we'll jump into those. But Dr. Rivas, what is your favorite thing about being involved with the Impact Ministries Clinic?
América de Ministerios de Impacto.
La relación con la gente es lo que a mí me apasiona.
What gives me a passion is the relationship with people.
Que siempre voy a encontrar a un niño que me va a dar un abrazo
I'm going
cada
to find
día.
a child that gives me a hug every day.
Gente que se va muy agradecida.
People that leave very thankful.
Y eso no nos hace, bueno, nos hace sentir importantes realmente.
It makes us feel important, really.
Pero siempre recordando que la gloria es para Dios.
But always remembering that the glory is for God.
Y también sentirme contento
I also am really happy
de que en alguna forma estamos
because
colaborando
one way or another we're helping
para engrandecer el reino de Dios
to grow God's kingdom
a través del servicio a la gente.
through service to people.
Y me gusta mucho
And I like it a lot.
la relación con el personal de Ministerios Impacto.
Having a relationship with the staff, the Impact Ministry staff.
Porque a pesar de que hay diferentes cargos,
there's different people with different jobs.
Pero de igual manera siempre veo
but I always see
que tanto el director ejecutivo
the executive director
como el que cuida la garita de la
or the one
entrada,
that's watching the gate at the entrance of the property.
Todos hacen su trabajo con mucho gusto, con mucha alegría.
Everybody does their job with happiness and the desire to do a good job.
Porque nuevamente el trabajo es para
Because
honra y gloria de Dios.
the work is for God's honor and glory.
Y no lo tomo como un trabajo,
I
sino
don't
que como un privilegio y
see
como
it
un
as
ministerio.
I don't see it as a job, but as a privilege and as a ministry.
That's awesome. Thank you so much for sharing. And we're just going to, if this works really quickly, I think our team in Guatemala has a short video where they'll just play a little bit of it that it's just going to show you a bit of what's going on around them at the clinic. So if Pablo wants to play that, see if that'll play. So this is just a little bit of the team that's down there this week. So they actually set this up in kind of our chapel room in one of the rooms. So I think this is at Chijulhá. Perfect. So yeah, that just gives you a little bit of an idea of kind of what's going on down there today. That's what's going on. So it's exciting to see all of those kids coming in and getting those treatments and the team working. So awesome. Thank you so much, Chris and Dr. Rivas, for sharing. We're going to jump right into a couple questions for the next about 5 minutes, and then we'll conclude the recording portion. But just a reminder to everyone, if you're able to stick around, we will be able to unmute and continue the conversation. So this is a question, and maybe I'll direct this towards Ruth and Dr. Rivas. That says, how does the service delivered by the clinic at Impact compare to what's available to the general population in Tactique?
Vamos a seguir en el público de Tactic.
En otras clínicas.
Así, ajá, sí, solo en el.
La diferencia es que
Can you hear us?
el Ministerio Sin Impacto,
Okay. The difference, yeah, está bien. Ajá.
la diferencia es que en la clínica del Ministerio Sin Impacto estamos trabajando con mucho amor.
And then one of the differences is that in Impact Ministries Clinic, we're working with a lot of love.
Ayer precisamente tuvimos un caso muy especial.
Yesterday, we had a very special case.
Una señora con un problema de un tumor en el pecho.
We had a woman with a tumor in her chest.
Le explicamos todas las repercusiones que puede tener si no tiene tratamiento
We
inmediato.
explained everything that could happen if she wasn't treated immediately.
Obviamente ella necesita ir a un hospital
She obviously needs to go to a hospital
porque no tiene recursos para pagar una clínica
because she doesn't
privada.
have the money to pay for a private clinic.
Pero ella decididamente dijo que no quería ir al hospital.
But she said she didn't want to go to the hospital.
Y su respuesta fue un poco extraña.
Her answer was a little bit strange.
Es que dijo, es que ahí me voy a morir más
She
luego.
said, I'm going to go and die there sooner.
Y tratamos de explicarle la necesidad y lo importante de que vaya al
And we
hospital.
tried to explain to her the need for her to actually go to the hospital.
Pero casos como estos nos hacen a nosotros notar la diferencia
But it's cases like that that make us notice the difference
entre la clínica del Ministerio Sin Impacto y el resto de clínicas.
from Impact Ministries Clinic and other clinics.
Porque acá siempre estamos dispuestos y atentos a
Because-
atender a la gente,
We're here to, willing to help the people,
tratar de ayudar en sus necesidades.
try to help them in their needs,
Y no necesariamente de salud, sino que también de otro tipo.
not necessarily their health, sometimes something else.
Tratamos de enseñarle y educarle
We try to teach them and educate them
lo que debe hacer para no continuar enfermándose.
what they need to do so that they won't keep getting sick.
Awesome. Thank you for sharing that. There's a question here that I'll answer just because it's a bit teams related, but how many medical teams are going down? So next year, I think we have about 3 or 4 kind of confirmed or tentative in the planning process for medical teams. But we have also introduced something called open medical. And usually we schedule about 3 open medical teams throughout the year. And this is a great chance. Maybe you want to come down and serve as part of a medical team, but you're not really sure if you'll be able to get enough interest where you're from. We have these open medical teams that usually they are led by a doctor who's been down there before, but it's really just a chance that if you want to come and serve with people from all across North America, that's a great opportunity. So I think Michelle just posted there just about medical missions, and that'll just link you to our website if you are interested. And as they said before, you don't have to be medical to be on a medical team. There's always room. There's always something to do. So check that out. And if you are interested in leading a medical team, if you're interested in finding out more information, I will post my email down there. I help organize teams from Canada, and we can also put the email address for the US teams coordinator as well. But just feel free to message us, and we're always open to just new inquiries. And Chris, yeah, maybe if you want to put your email too, and then if people have some medical questions, they can send that your way. But yes, please feel free to reach out at any time. So I'll add my email in here. Perfect. And again, if anyone else has any questions, please feel free to write them in the chat. I think we do have. Chris, we asked Dr. Rivas this question, but we didn't ask you it. But what's your favorite thing about being involved with the Impact Ministries Medical Clinic?
Oh, wow. I tell you, just from the minute we open up a clinic till we close a clinic, just taking care of the people. Dr. Rivas alluded to it, but there's medical care available in other places in the area. I don't think it's the quality that we are able to give them there, but we show them Jesus. You know, we literally show them the love of Jesus, and we're not just taking care of them medically, we're taking care of them spiritually. And I tell you, people pour their hearts out to you when they know you're there. There's no secondary gain, you know, this is a free clinic. We give them their medications for free. We, you know, refer them. We do everything we can to keep their costs, you know, nothing, if not minimal. But, you know, the people just love on you, and we love on them. And just, again, hear them pour their heart out to us and tell us the stories of what they went through, and then praying for them. And the people are so thankful. They're so grateful. And, you know, as you know, with a lot of mission trips, sometimes, you know, you get a lot more out of it than you put into it. And I would say every time I go down there and spend time taking care of patients, I leave and I'm so happy that I came, and happy to take care of the people. But I think it's really just showing them the love of Jesus and them pouring their hearts out into you. And just medicine in North America is much different than that. But from a personal standpoint, I think it's just seeing them and to show them the love of Jesus. And then I love the children. I mean, just the children, the Impact Ministries children. If you get people here on the call have been to one of their devotionals in their schools, oh my gosh, just how much they love Jesus, and you know, listening to them pray, listening to them worship him with songs. I just love that. I can't get enough of that. So I'd say those are my favorite things.
Awesome. Well, we may kind of wrap up this kind of official recording portion. And again, if you are able to stick around for 15 more minutes, we're just going to allow you to unmute and we can continue the conversation. I know there's some of you guys who have been on medical mission trips, and maybe you can share a little bit, but just want to again say thank you for joining us. Thank you, Dr. Chris. Thank you, Dr. Rivas and Ruth, for just being a part of this tonight. We do want to remind you to just keep your eye out for the newsletter that will be coming out next week. And there's lots of good stuff in there. There's a couple stories just of what's happening in the clinic. So make sure you watch for that. And our next Vida Live is going to be on October 17th. And we'll be focusing on the children's home. So make sure you mark that down, and we're excited for that. It's going to be at 3 p.m. Guatemala time. So just keep a watch out for that. But again, just want to say thank you. It's been such a joy to be with you guys tonight. If you need to leave after this, feel free. But if you want, we'll let you unmute and we'll just continue the conversation.